There are several cancer diseases that affect the human body, but with emphasis are those predominantly affecting women of all age and race.
If we want to look at the cancers that are specifically related to women, then we have breast cancer, cervical cancer, ovarian cancer, thyroid cancer. But more or less, any cancer can actually occur in a woman, except for things like prostate cancer, because the woman doesn't have a prostate.
But there is a sixth one, a very rare type, and that is the fallopian tube cancer. However, these cancers come with varied symptoms in a woman's body.
The most common symptom that you find in breast cancer is actually a lump, usually a painless lump in the breast that increases in size as time goes on. But of course, you have other symptoms like nipple discharge. When you have abnormal nipple discharge that is bloody or the color is altered, then it calls for concern. Of course, you can also have things like nipple deviation, and you can have even wound. You can have a sore. Then there can also be a lump in the armpits. For cervical cancer, the woman can present with vaginal bleeding, vaginal discharge. Usually this differ from the normal vaginal bleeding of menstruation. So it can be in women that have stopped menstruating and then suddenly they start seeing blood. It's not normal. And then there can be discharge also. We know that there's a normal vaginal discharge, but for this one, it is usually very plenty. It's described as copious, usually very plenty. It's also foul smelling. For thyroid, the thyroid is an organ that is seen in the neck. So usually there will be, an anterior neck swelling.
With these symptoms in mind, every woman, irrespective of your disposition, is advised to get regular checkups to either get early intervention or prevention of the disease.
The survival rate for any cancer depends on the stage at which the cancer is gotten. So when you catch it at a very early stage, and that's why screening is advocated, you can have complete cure. But when you get it at advanced stage, then the survival rate goes down as the stage increases.
As you know, many women are concerned about their reproductive health.
When you're talking of the statistics for breast cancer, usually it's commonly found in women, postmenopausal women. That's women that have stopped menstruating. But of course, now we're seeing it in younger women, in women that are still even menstruating, in women in their reproductive age. Commonest age group is between the ages of 45 to 55, which is actually like a decade lower than what you see in the advanced country, where theirs start from about 55 to 65.
And so, more awareness are needed, especially in rural communities where access to health interventions and facilities are scarce.
I would not say you find oncologists in rural areas. You find them in most of the teaching hospitals and the big tertiary hospitals. And so if a woman presents in whatever hospital she uses, even if it is not available there, she can be directed to where she can have it. As per subsidy and all that, I know that there are a lot of non-governmental organizations that sponsor these things and, give free screening periodically, especially when you mark the World Cancer Day or when you mark Breast Cancer Month in October.
So, now you know, always check out for these irregular growths on your body or changes in your body system. You may be fighting the disease head on.